The rest of our chapter focuses on blood pressure, so let's take some time to look at all the factors that affect blood pressure. Your blood pressure is a result of three main things. The first is cardiac output. We learned about this in chapter 19. This is the liters of blood pumped by one ventricle in 1 minute. Our second factor is resistance. We learned about this in an earlier video in this chapter. Arteries resist receiving blood from the heart. And the heart must work to overcome this resistance. Our third factor is blood volume. This is basically the amount of water in your blood. Each of these factors is further broken down into things that influence them. We already know from chapter 19 that cardiac output is heart rate times stroke volume. Resistance has three factors. The first is vessel diameter. The second is vessel length. And the third is blood viscosity. The amount of water in your blood is controlled by two things. One is how much you drink. The other is how much urine your kidneys produce. Each of these individual factors can act to raise or lower blood pressure. Your total blood pressure is the combination of all of these factors working together. We know with heart rate, if you increase heart rate, you increase cardiac output. A higher cardiac output will result in higher blood pressure. Things that increase heart rate include sympathetic stimulation and positive chronotropic agents. This would be things such as thyroid hormone, caffeine, nicotine, and cocaine. You can also decrease heart rate. If you decrease heart rate, you decrease cardiac output, which decreases blood pressure. Parasympathetic stimulation will decrease heart rate, as will negative chronotropic agents. This would include things such as beta blocker and calcium channel blocker drugs. Stroke volume can also have an effect. If you increase stroke volume, you increase cardiac output, which increases blood pressure. Stroke volume is increased by sympathetic stimulation, increased venous return, the Frank-Starling law of the heart, and positive inotropic agents. This would include your same positive chronotropic agents along with digitalis. This is also known by its brand name, digoxin. This is the drug that traps the calcium in the muscle and makes it contract harder. If you decrease stroke volume, you will decrease cardiac output, which will decrease blood pressure. We're not going to put parasympathetic here. Remember, it only affects the nodes, not the myocardium. But this could be negative inotropic agents and electrolyte imbalance. Now we can look at the resistance factors. With vessel diameter, if you constrict your blood vessels, you increase resistance, which increases blood pressure. If you dilate your vessels, you decrease resistance, which decreases blood pressure. When it comes to vessel length, longer vessels will increase resistance, which will increase blood pressure. Having shorter vessels, such as by losing weight, will decrease resistance, which will decrease blood pressure. And with viscosity, having high viscosity will increase resistance and increase blood pressure. A lower viscosity will decrease resistance and decrease blood pressure. Now we can look at blood volume. The more you drink, the more your blood volume. The more blood volume you have, the more pressure it puts on your vessels. So you have higher blood pressure. When it comes to urine production, the more urine you make, the lower your blood volume, because making urine takes water out of your blood. And if you reduce blood volume, you reduce blood pressure. So drinking more raises blood pressure, urinating more lowers blood pressure. In the next videos, we'll look at how your body manages these factors in order to maintain homeostasis of your blood pressure.